Question 1. A nurse is preparing to care for a patient with tuberculosis. Which PPE is essential? A. Surgical mask. B. N95 respirator. C. Face shield. The answer is B. N95 respirator. Question 2. A client with C. difficile infection requires what type of precautions? A. Droplet. B. Contact. C. Airborne. The answer is B. Contact. Question 3. The most effective way to prevent healthcare-associated infections is A. Wearing gloves. B. Disinfecting surfaces. C. Hand hygiene. The answer is C. Hand hygiene. Question 4. A nurse is reinforcing teaching about home oxygen therapy. Which statement indicates a need for further instruction? A. I'll use petroleum jelly for dry lips. B. I will avoid smoking near the oxygen. C. I will store the oxygen tank upright. The answer is A. I'll use petroleum jelly for dry lips. Question 5. A client on seizure precautions should have which equipment at the bedside? A. Suction setup. B. Blood pressure cuff. C. Incentive spirometer. The answer is A. Suction setup. Question 6. What is the first step if a fire breaks out in a client's room? A. Rescue the client. B. Activate the alarm. C. Close all windows. The answer is A. Rescue the client. Question 7. When lifting a heavy object, the nurse should A. Bend at the waist. B. Twist at the torso. C. Bend at the knees. The answer is C. Bend at the knees. Question 8. What is the appropriate action after a needle stick injury? A. Continue with client care. B. Wash the site with soap and water. C. Cover with a bandage and move on. The answer is B. Wash the site with soap and water. Question 9. Which precaution is appropriate for a client with influenza? A. Contact. B. Airborne. C. Droplet. The answer is C. Droplet. Question 10. What is the correct order for doffing PPE? A. Gown, gloves, goggles, mask. B. Gloves, goggles, gown, mask. C. Mask, gown, gloves, goggles. The answer is B. Gloves, goggles, gown, mask. Question 11. A nurse sees smoke in the hallway. What should be done first? A. Close the doors. B. Remove clients from the area. C. Call the fire department. The answer is B. Remove clients from the area. Question 12. Which client situation requires immediate isolation? A. Client with chickenpox. B. Client with a UTI. C. Client with a broken leg. The answer is A. Client with chickenpox. Question 13. What is the correct disposal method for a used needle? A. Place in a sharps container. B. Recap and discard in trash. C. Snap and flush. The answer is A. Place in a sharps container. Question 14. A nurse observes another nurse not washing hands after removing gloves. What should be done? A. Ignore the behavior. B. Immediately report to the hospital administrator. C. Remind the nurse to follow hand hygiene protocol. The answer is C. Remind the nurse to follow hand hygiene protocol. Question 15. Which is a safety hazard for an older adult living alone? A. Handrails in the hallway. B. Area rugs. C. Shower chair in the bathroom. The answer is B. Area rugs. Please like and subscribe. Question 16. Which condition requires airborne precautions? A. MRSA. B. Tuberculosis. C. RSV. The answer is B. Tuberculosis. Question 17. When should hand hygiene be performed? A. Before client contact only. B. After contact with blood only. C. Before and after client contact. The answer is C. Before and after client contact. Question 18. What is the best method to clean a blood spill? A. Bleach solution, 110. B. Alcohol-based sanitizer. C. Warm soapy water only. The answer is A. Bleach solution, 110. Question 19. Which food should be avoided by a neutropenic patient? A. Cooked vegetables. B. Raw salad. C. Pasteurized milk. The answer is B. Raw salad. Question 20. Which restraint is best for a client who keeps pulling at a nasogastric tube? A. Wrist restraint. B. Elbow immobilizer. C. Belt restraint. The answer is B. Elbow immobilizer. Question 21. Which condition requires droplet precautions? A. Influenza. B. Hepatitis C. C. Tuberculosis. The answer is A. Influenza. Question 22. What's the priority nursing action if a confused client begins to climb out of bed? A. Call the healthcare provider. B. Activate the bed alarm. C. Stay with the client and guide them back to bed. The answer is C. Stay with the client and guide them back to bed. Question 23. Which is an example of breaking sterile technique? A. Touching a sterile glove to a non-sterile surface. B. Keeping hands above waist level. C. Opening a sterile package away from the body. The answer is A. Touching a sterile glove to a non-sterile surface. Question 24. A nurse is teaching a client about fire safety at home. Which statement requires follow-up? A. I use extension cords under the rug. B. I check smoke alarms monthly. C. I keep a fire extinguisher in the kitchen. The answer is A. I use extension cords under the rug. Question 25. A nurse prepares to care for a patient with measles. What PPE is required? A. Surgical mask. B. Gown and gloves. C. N95 respirator. The answer is C. N95 respirator. Question 26. The proper sequence when donning PPE is: A. Gloves, mask, gown, goggles. B. Gown, mask, goggles, gloves. C. Mask, gown, gloves, goggles. The answer is B. Gown, mask, goggles, gloves. Question 27. What's the appropriate action when a client refuses prescribed medication? A. Document the refusal and notify the provider. B. Hide the medication in food. C. Insist that the client takes it. The answer is A. Document the refusal and notify the provider. Question 28. A nurse notices a spill in the hallway. What should be done first? A. Place a wet floor sign. B. Call housekeeping. C. Walk around it carefully. The answer is A. Place a wet floor sign. Question 29. A client asks how to dispose of used insulin needles at home. What should the nurse say? A. Use a thick plastic container like a detergent bottle. B. Place needles in paper bags. C. Throw them in the trash if capped. The answer is A. Use a thick plastic container like a detergent bottle. Question 30. Which is a sign of potential elder abuse? A. Clear documentation of injuries. B. Pressure injuries in various healing stages. C. Family bringing meals daily. The answer is B. Pressure injuries in various healing stages. Question 31. What action should the nurse take if they see a client about to fall? A. Catch the client under the arms. B. Ease the client to the floor. C. Call for help and wait. The answer is B. Ease the client to the floor. Question 32. What should the nurse do first after discovering a fire? A. Evacuate all patients. B. Rescue anyone in immediate danger. C. Call the fire department. The answer is B. Rescue anyone in immediate danger. Question 33. Which infection requires contact precautions? A. COVID-19. B. MRSA. C. Influenza. The answer is B. MRSA. Question 34. Which client is at the highest risk for a fall? A. 25-year-old post-appendectomy. B. 68-year-old with dizziness and antihypertensives. C. 50-year-old recovering from pneumonia. The answer is B. 68-year-old with dizziness and antihypertensives. Question 35. A nurse is caring for a patient with neutropenia. What diet instruction is appropriate? A. Avoid raw fruits and vegetables. B. Eat rare meats for more iron. C. Drink unpasteurized milk for gut flora. The answer is A. Avoid raw fruits and vegetables. Question 36. What's a proper response when a client has a latex allergy? A. Avoid powder-free gloves. B. Use vinyl or nitrile gloves. C. Remove all linens from the room. The answer is B. Use vinyl or nitrile gloves. Question 37. Which action is inappropriate when using a gait belt? A. Fasten belt snugly. B. Hold belt at the back. C. Secure belt over bare skin. The answer is C. Secure belt over bare skin. Question 38. What is the safest method for identifying a client before administering medication? A. Ask the room number. B. Ask the client to state their name and date of birth. C. Look at the bed label. The answer is B. Ask the client to state their name and date of birth. Question 39. Which of the following is appropriate when using restraints? A. Secure restraints to bed rails. B. Assess the client every 2 hours. C. Use a quick-release knot. The answer is C. Use a quick-release knot. Question 40. What is the best way to prevent patient injury during ambulation? A. Encourage independence without assistance. B. Use a gait belt for support. C. Let the patient lead the pace independently. The answer is B. Use a gait belt for support. Question 41. Which of the following is a breach of infection control? A. Wearing gloves while cleaning a wound. B. Using hand sanitizer between patients. C. Wearing artificial nails in clinical care. The answer is C. Wearing artificial nails in clinical care. Question 42. What's the best strategy to reduce catheter-associated urinary tract infections? A. Inserting catheters in all incontinent clients. B. Using a sterile technique for insertion. C. Encouraging clients to hold their urine. The answer is B. Using a sterile technique for insertion. Question 43. Which situation requires a sterile technique? A. Inserting a Foley catheter. B. Checking a blood glucose. C. Assisting with oral medication. The answer is A. Inserting a Foley catheter. Question 44. What is a priority action during a code red fire on the unit? A. Open windows for ventilation. B. Shut all patient room doors. C. Call environmental services. The answer is B. Shut all patient room doors. Question 45. Which infection control measure is used for RSV? A. Contact precautions. B. Droplet precautions only. C. Airborne precautions. The answer is A. Contact precautions. Question 46. The best way to prevent a fall in a confused patient is: A. Raise all side rails. B. Keep the bed in low position. C. Use physical restraints. The answer is B. Keep the bed in low position. Question 47. Which of the following indicates the need for further teaching about home safety? A. I keep a night light in the hallway. B. I store medications in a locked cabinet. C. I use the top shelf of a closet for frequently used items. The answer is I use the top shelf of a closet for frequently used items. Question 48. What PPE is needed when entering the room of a client with chickenpox? A. Surgical mask and gloves. B. N95 respirator and gloves. C. Gown and goggles only. The answer is B. N95 respirator and gloves. Question 49. Which task can safely be delegated to an unlicensed assistive personnel, UAP? A. Monitoring for infection. B. Assisting with bathing. C. Administering oral antibiotics. The answer is B. Assisting with bathing. Question 50. What is the best way to handle a patient with a history of falls? A. Restrain the patient to prevent movement. B. Document the history and monitor monthly. C. Implement a fall risk protocol with frequent rounding. The answer is C. Implement a fall risk protocol with frequent rounding. Please like and subscribe. How many did you get right? Comment below.